Good morning. On March 7th, exactly 2 years ago today, in 2020, the first case of COVID-19 was confirmed right here in St. Louis County. Since then, our response has been quick, equitable, based on data, and based on science. Protecting lives has always been our top priority. Today, on the 2-year anniversary, there's optimism. Average daily cases are below 65, and our positivity rate is hovering around 5%. Hospitalizations have dropped significantly, and our health systems are no longer stressed with cases of COVID-19 due most recently to the Omicron variant. And vaccines are widely available. Across the country and here in St. Louis County, our health departments led the response to COVID. And they did so while providing a wide range of services that were available pre-pandemic. Public health departments are the safety nets, ensuring those that are uninsured and underinsured have access to health care. And reproductive and sexual health services are an important part of our public health department's role. Some of the services that are provided include family planning, counseling, and other options, nutrition services, annual exams, screening primarily for female cancers, and the services related to pregnancy, childbearing, and childbirth are integrated into our primary care services. Testing and treatment for sexually transmitted infections are also an important part of the services provided by the health department. In addition to these specific services and initiatives, our health department supports policies that improve the social determinants of health, and those include access to all types of health care, economic stability, quality education, safe housing, and safe neighborhoods. And we note that not all individuals who use women's health services identify as women. Transgender and non-binary individuals may utilize these services and deserve non-judgmental and culturally responsive care that meets their needs. The department's nursing program includes visits to postpartum patients, pregnant patients, and infants. And these programs focus on healthy pregnancy, labor and delivery, infant feeding, and overall health and wellness of the parent and the infant. And our commitment and why we stand here today is to ensure that reproductive and sexual health services not only continue in St. Louis County, but they're expanded. The political talk about pro-life and pro-choice leaves out those who are directly impacted. And those talks fail to make a part of the conversation the many forms of safe and effective contraception. And those attacking reproductive rights are really attacking our most vulnerable, making decisions for them instead of providing well-marked avenues to information and to services. So today I stand here with advocates for expanding access to reproductive and sexual health services here and across the country. Expanding these services is a commitment to providing equitable access to services and recourses to address health and racial disparities. Through our 3 community health centers and in our Justice Center, over 1,500 individuals are treated each year. About 3/4 of them are Black, and the majority live in high-poverty neighborhoods. And the U.S. Department of Health and Senior Services has identified reducing the national rate of unintended pregnancy as a critical step to improving health in our country. Unintended childbearing is associated with smoking and drinking during pregnancy, premature birth, high rates of child neglect, and maltreatment. Today I'm signing an executive order committing St. Louis County to reproductive and sexual health services. And the order states, in part, that there shall continue to be a program administered by the department to improve information and access to quality contraceptive services. And that program shall be expanded, including training and patient counseling, racial bias training, and comprehensive clinical training around contraception. Through this executive order, the Department of Public Health shall strengthen its partnership with the Missouri Family Health Council and explore additional partnerships and funding opportunities. And the department will work to increase its promotion and availability of reproductive health services. With additional resources, the department can train staff on reproductive health procedures. And it's a priority of our department to train staff to offer care in a responsible and gender-affirming manner, so that patients are comfortable seeking care regardless of their gender identity or sexual orientation. And another way to improve services is to expand infrastructure. Our North Central Community Health Center has significant structural problems that impede our ability to provide care for our current patients. These issues also impact our ability to extend services to additional patients that need help and are underserved parts of the county. A new electronic health record system would allow for improved clinical care and wraparound services. The current electronic medical record was brought into service 20 years ago. With the expansion of Medicaid in Missouri, more uninsured residents have access to health coverage. So hiring additional staff to help enroll patients would also substantially increase reliable and affordable access to contraceptions and to family planning. Yes, most of this comes with a price tag, but we're in a unique position with an unprecedented amount of federal funding coming our way. And improving access to health care in North County is a priority for the majority of our council members. And the time has never been more clear to renew our commitment to providing reproductive and sexual health services. During Women's History Month, the stories of reproductive rights and access to sexual health services in our country will not be provided in a flattering light. The future chapters of our country's history must provide not only hope, but commitment to show how we do not leave our most vulnerable stock in the gridlock of politics. Thank you, and I'd be glad to answer any questions.
Dr. Page, on COVID, you've been sounding more optimistic lately, perhaps at least than
Right.
I think we've heard you in the last 2 years plus. Where are you at today? Do you think we're at the best spot we've been, or kind of what's your mindset today about on the anniversary of where we're at with COVID?
So the question is about where we are with COVID today, and what's our position. We're clearly in a much better place than we've been in a long time. Cases are lower than they've been in a long time, and importantly, our health systems are no longer overwhelmed with COVID cases. So we're optimistic. We're glad we're headed in the right direction, and we're going to remain wary of COVID, but also talk about and focus on the other services the Department of Public Health provides. And today, we're talking about expanded access to contraception in St. Louis County and the partnerships that we've developed and we're going to continue to develop to improve access to contraception services.
With the anniversary and now that there's no mask mandate anymore, some people have this mindset that we're out of the woods, it's over. What would your message be to that time?
So the question is really, where are we today and what does it mean? No, I don't think we're completely out of the woods, but I am very happy with the direction, the point we are today and the direction that we're headed. I think we need to continue to get people vaccinated because that will protect us in the coming months. We need to continue to talk about vaccinations. We need to continue to be thoughtful about patients with people with underlying health conditions, people who are immunocompromised, who are much more vulnerable to COVID than others in our community.
Aren't you interested in signing the executive order?
Okay, great. Okay, thank you for coming this morning, and thank you to our partners who've joined us to help us get the message out that St. Louis County Department of Public Health is focused on expanding healthcare services in the county, especially those related to contraception and family planning. Thank you.